All right, thanks, Ryan. Nearly 50% of women will experience urinary incontinence during their lifetime. Here to talk about bladder health and simple solutions for urinary incontinence is Dr. Elizabeth Sappenfield, a urogynecologist with Hartford Healthcare Medical Group. Doctor, welcome.
Thank you.
Great to have you. So what is the most common type of urinary incontinence?
So one of the most common types of urinary incontinence is something called stress urinary incontinence, and that's where you leak when you laugh, cough, sneeze, or exercise. The other type is called urge incontinence, and that's when you leak when you have a strong urge of needing to go to the bathroom. The most common is having both of these.
All right, how common is this condition, and is it treatable?
Yeah, so 50% of women will have urinary incontinence, and it's definitely treatable. So for stress urinary incontinence, options include doing pelvic floor muscle exercises or seeing a pelvic floor physical therapist to strengthen those muscles, using a pessary device, which is a device that fits into the vagina to help support the urethra, or a minimally invasive surgery that can be 80 to 90% successful at treating stress incontinence. For urge incontinence, options include medications, an office procedure with Botox, or procedures to reprogram the bladder called posterior tibial nerve stimulation or sacral neuromodulation.
Wow, those are some options. So how can one keep their bladder healthy?
Yeah, so some tips to keep your bladder healthy are to exercise and maintain a healthy weight, avoid those bladder irritants such as caffeine or alcohol, or limit use. Pelvic floor muscle exercises help as well. And drink plenty of water, but go to the bathroom when you need it.
All right. And doctor, what should a woman expect when they come to you about urinary incontinence?
So when a woman sees me for urinary incontinence, we'll have a detailed discussion about when she leaks and what's going on, her relevant past medical history. I'll do a physical exam, which would include a pelvic exam. We'll usually check her urine to make sure she doesn't have infection or any other concerning signs. And then we'll talk about treatment options.
All right, and I have a quick last question. Tell me about your specialty, a urogynecologist.
Yeah, so urogynecology, it's a combination of urology and gynecology in that we have a passion for treating women with urinary incontinence, fecal incontinence, prolapse, or other irritating bladder or pelvic symptoms. So generally it can be OB/GYN trained or urology trained, and then do a subspecialty in female pelvic medicine and reconstructive surgery. So
interesting. Well, you're helping a lot of women. We thank you for all the information. Dr. Elizabeth Sappenfield with the Hartford Healthcare Medical Group, thank you very much.